We are moving into what some are calling the twindemic, which is the flu season coupled with the pandemic. So are there any immune hacks that we should be, should be on our radar? Dr. Roizen, can you share a little bit of that with us?
When people have looked at what gives you a better antibody reaction to the flu vaccine, so one of the hacks is get the flu vaccine. Now, we have very few cases of flu in the United States right now. We think it may be due to mask wearing. No one knows really why, but we have very few cases. But you still want to get the flu vaccine. And when you do that, what increase, and this we assume will occur with the SARS-CoV-2 vaccine, it is sleep, vitamins, and moderate exercise, not extreme exercise beforehand, and then some vitamins and supplements. I want to say where I work is at the Cleveland Clinic, and just yesterday they came out with the fact that when they look at the database, they have 3 million people, those who were taking melatonin had about a 40% reduction in hospitalizations for COVID-19 compared to those who weren't. So maybe that's something you want to consider. But sleep is the key, so you want to get 7 to 8 hours beforehand. If you run a marathon for the next 3 weeks, you have an increased risk of flu and of upper respiratory infections. And in fact, all infections, even leaky gut. So you want to do the usual exercise. Those 10-minute hacks that were mentioned are a great way of getting exercise without overdoing it and destroying your immunity. So moderate exercise, sleep, and then a multivitamin was the third thing that was shown to have. If you take that beforehand, again, half in the morning, half in the evening, it's a great way that Persona has it, because that will give you a stable level and increase your antibody response to a vaccine. And then I don't want to minimize the fact we want to have a vaccine. So get your flu vaccine, and hopefully when the COVID-19 comes out, it'll be safe and effective. So we'll probably all get in line for that.